welcome back to the Breaking Barriers podcast. I'm Trilaka, your host for today's episode. Today, we're diving into a topic that's often left in the shadows, yet it affects countless of mothers around the world: postpartum mental health. After childbirth, so much of attention is placed on the baby's well being. But what about the mother's emotional journey? In today's episode, we will be exploring the silent struggles that many new mothers face and what it truly means to heal after birth. We are incredibly honored to have Dr. Siti Roshaida Muhammad Arifin join us today in today's episode. She is an associate professor and head of research at the Kuliah of Nursing International Islamic University of Malaysia. With a strong focus on maternal and perinatal mental health, Dr. Roshaida brings both clinical experience as well as research insight into this vital conversation. Dr. Roshaida, thank you so much for being here with us.
Thank you so much, Relika.
Let's start off by getting to know you a little. So, Dr. Roshaida, can you share a bit about your work in maternal and perinatal mental health?
Thank you so much, Relika, for your kind introduction. Hello, hi everyone. I would like to thank to MMI for your invitation. So I would like to share a bit about my work in perinatal mental health. I believe this is the area that has been close to my heart since many years. And my journey in this field actually began in 2009 during my master's degree. So at that time, I was deeply drawn to understand the emotions, the psychological changes that mother had during and also after pregnancy. And that curiosity and concern also led me to pursue a PhD in the UK in 2013, where I focused specifically on the experiences of postnatal depression among Malaysian mothers. I would say it was a powerful learning journey, not just academically, but also personally, because at that time I began to understand the impact of the culture, the impact of the religious, and also the social factors on how women actually experience and express their emotional distress after childbirth. So, since returning to Malaysia, I have continued this work through various research grants and also community programs, starting from 2016 onwards. And my projects have included qualitative studies on women's experiences and the roles of nurses, midwives, and also other healthcare providers. And most recently, we have developed awareness campaigns and also school-based mental health programs with the strong focus on the early prevention and also support. And one of the my proudest initiative is being part of the Southeast Asia UK partnership in perinatal mental health, and this is regional collaboration that looks at how we can raise awareness, we can reduce the stigma, and also how we can improve access to care across Malaysia, Indonesia, and also Thailand. And I have also worked closely with the government bodies and also with NGO to advocate policy changes and also to ensure that the maternal mental health becomes an important part of our healthcare system. Of course, this is a long journey, Srileka, but I believe that change is possible through research, through awareness, and also through collaboration.
Thank you so much, Dr. Shaida, for sharing such an exciting and long, lengthy career, I would say. It's truly inspiring to have you join us today. I believe this episode will be beneficial for our listeners. And with your expertise and experience, we will definitely provide a much more meaningful conversation today. So, for those who are unfamiliar, like our audiences, could you please help us define what exactly is postpartum depression and how is it different from the more commonly heard baby blues?
That's a really good question. I received that question quite a lot.
Mm-hmm.
I believe that many people hear about baby blues or postpartum depression, but they don't really always sure what the differences are, right? So it is important for us to talk about this clearly. It's not about, I mean, it's not only among the public, but also sometimes among our nurses who are working in the primary healthcare setting. So postpartum depression, of course, is a type of mental illness, mental health issue that can happen to mother after giving birth, and is more than just feeling tired or emotional, right? So a mother, they can feel very sad, hopeless, and also like empty inside. She might lose interest in things that she used to enjoy. She might feel disconnected with her baby or think that she's not a good mother, right? So sometimes the feelings are so heavy that she might have thoughts of harming herself or even the baby, although this is not common and very scary for some mothers. And the prevalence is about 20% of the new mother have this kind of mental health issues. So now how it can different from the baby blues. So baby blues are actually very common. In fact, most of the new mothers around say 70 to 80% will feel this baby blues or will experience this baby blues. They might feel a bit emotional. They can cry easily or feel stressed in the first few days after the childbirth. But the key thing is baby blues are mild and they usually go away after, let's say, after 1 or 2 weeks. But postpartum depression is stronger, lasts longer, and does not go away by itself. So it needs care, it needs support, like talking to the professionals, talking to the nurses, midwives, or the doctors, join in support group, for example, and sometimes some of the mother, they need to take the medicine. So to make it simple, baby blues is a short, is a mild, and also common. But postpartum depression is more serious, lasts longer, and needs help.
Thank you so much, Dr. Shaida, for explaining the key difference between baby blues and postpartum. In your personal experience, as you mentioned, why is postpartum depression often underdiagnosed or overlooked, especially here in Malaysia?
All right, that's another great thing. There are a few reasons, of course, why these cases are underdiagnosed or overlooked. Number one, I believe that many mothers or even people around them, our community, think it is normal to feel sad. It's normal to feel tired, or it's normal to feel overwhelmed after giving birth. So when a mother starts showing signs of depression, people may say, this, you are just tired, right? Or it will pass, just be strong, right? So because of this, actually the mother might ignore their own feelings or feel guilty for not being happy, right? So that's number one. Number two, perhaps there is still a stigma around mental health in our society. Many women are afraid to speak up. They worry that others will judge them, and they say they are not good mothers or think they are weak. So they keep quiet and even they suffer. They suffer inside. They're not revealing their own feelings, their actual feelings to other people surrounding them. The third one would be some of the healthcare settings does not always check for mental health during postnatal checkups. Most of the focus is on the baby's health, or on the mother's physical recovery, but not enough on how she's feeling emotionally or mentally. So unless the mother bring it up herself, it might go unnoticed. And lastly, I believe that the cultural belief also play a role in some families. People believe that sadness or anxiety should just be kept to yourself, or that is something you can pray away or just endure, tahan, right? While I believe faith, of course, can be important, but mental health is real and needs to proper care. All right, and all of these things like lack of awareness, stigma, and not enough mental screening, and also cultural pressure, make it easy for postpartum depression to be missed, especially in our healthcare settings.
Thank you so much, Dr. Shaida, for sharing all this. It is truly important for us to create awareness, to bring more education, especially for young mothers out there who might be dealing with postpartum depression, but they are not aware of it. So thank you so much for sharing that. Now let's talk more about what this condition, postpartum depression, actually looks like. From your clinical experience, once again, what are some of the most common symptoms of postpartum depression that families or even mothers themselves should be aware of?
Yeah, I think I did mention just now, Srileka, about the nine symptoms, the nine signs and symptoms of what we call postpartum postpartum depression and anxiety. And if, let's say, I mentioned that if any of the mother experience five of these nine clinical manifestations, then there is what we call there is the need for the mother to go and find the professional help, get professional helps to be treated. I mentioned about the feeling sad, worthless, for example, right? And also not interested what she's doing before, and difficulty to make decision, and she feel that she wants to disappear, for example, suicidal thought, infanticidal thought, yeah, or thinking about killing or hurting herself or the baby. And the next one is regarding the eating habit, the sleeping, right? The changes in sleeping patterns, restless, and also feeling tired all the time. So I believe that these are the symptoms that the women, the mothers themselves, and also the family members, the husband should aware of, so that they can support, also they can get help if these things happen.
Doctor, sometimes mothers feel guilty for not feeling happy after giving birth. Is it something that you encounter often?
Yes, absolutely. Many mothers actually expect to feel happy, expect to feel excited and full of love after giving birth, because that's what we often see from movies, on social media, and also that's what we hear from others too, right? So, but in real life, not all mothers feel that way. And when they don't, they start to think, what's wrong with me? They feel guilty for not feeling joyful. Um, they might say things like, I should be grateful, I have a healthy baby now, why I'm crying all the time, others mother can handle, why I cannot handle these feelings. So this guilt is very real, and very painful. It makes the mothers feel ashamed to talk about her feelings. So she hides it, keeps smiling on the outside, while suffering on the inside. But the truth is, not feeling happy after giving birth does not mean that you are a bad mother. It does not mean that you don't love your baby. It simply means that your body, your mind are going through a lot. The hormonal changes, lack of sleep, stress that you have after giving birth, or maybe some of the mother even have trauma from the childbirth. And sometimes those feelings are signs of postpartum depression or postpartum anxiety, which are medical conditions, and not a personal failure, I would say. So yes, Rebecca, I've seen this quite a lot, quite often, and I always remind mothers that you are not alone, and it's okay to feel what you feel. What's matter is that you get the support you need. So with the help, normally the mother can feel better and they can enjoy their motherhood again, right? On their own time, on their own way.
Thank you so much, Dr. Shade. That's truly meaningful and something that all mothers should know. Thank you so much. Also, you did mention that hormonal changes can be one of the risk factors that contribute to postpartum depression. But I imagine it's much more complex that not only hormonal changes and hormonal imbalance play a role in postpartum depression. Could you explain a little bit more about the biggest risk factors that contribute to PPD, postpartum depression?
Right. That's very insightful question, and you are right, Srineka. It's not just about the hormones. While hormonal changes do play a role after childbirth, we believe that. But postpartum depression is much more complex than that. In my experience, postpartum depression usually happens because of a combination of many hormones, many factors, not just one factor. So wrong factor come at the wrong time, wrong combination that finally can cause postpartum depression. One of the biggest risk factor that can increase the chance of mother developing postpartum depression, it can be, for example, number one, lack of support. This is the major one. When a mother feels alone, no emotional support from husband, from family, or from friends, it can make the situation much more harder, right? So she may feel like everything is on her shoulders. So that's number one. Even if we read in the literature, lots of the papers talk about lack of support. Number two is the financial constraint or financial stress, worrying about money, paying bills, buying baby items, and also, for example, some of the mother they take unpaid leave from the work, which can add lots more pressure for them, and this can affect her mental health, especially when combined with other factors just now, sleepless night, and also the exhaustion, the trauma that she had from the childbirth. And that's number two. Number three is, I believe that the cultural and also social pressures. Um, in many cultures, including ours, right? There is this idea that the mother must be strong
Mm,
or sacrifice everything or never complain, right? So
mm,
some women feel ashamed if they can't live up to that image
mhm,
and create guilt and also silence. And another one quite interesting when I did my research, there's a lot of discussion on tradition versus modernity. I mean, tradition versus modernity conflict when the older and the younger generation, they have different perspective towards the traditional postnatal practices, or towards the child management, towards the breastfeeding. So when the mother-in-law, for example, say that you don't have to breastfeed your baby, whereas the new mothers, they feel that, okay, they have to breastfeed their baby. So there's conflict over there. And lots of the taboo, postnatal taboo that we have, especially in Malaysia, regarding the traditional postnatal practices, for example, the way that you eat, the way that you take care of your wound, everything. So this one actually can create some tension over there and can leave some pressure for the woman. The next one would be the relationship problem, the conflict with the husband, conflict with the family, for example, or if the pregnancy was not planned, not welcome. So this can also lead to the emotional distress after childbirth. And the mothers who have a past mental history, if the mother, let's say, have the experience of, I mean, have the diagnosis or being diagnosed with depression, anxiety before this, or she might have trauma. So these are the group with the higher risk of developing postpartum depression. The next one would be the birth experience. The mother who had a difficult labor, for example, had emergency cesarean section, or feeling like she was not listened during their childbirth, and also these factors can affect their mental well-being afterward. And the mother who have the ill baby, the conditions of the baby, if the baby is born premature, for example, if the baby is sick or need to stay in the neonatal intensive care unit and ICU, it can cause a lot of stress and worry for the mother. And the next one, I would say this is the personal traits, the personal factor, which is the mother who have high expectations. Some of the mother, they expect to feel love instantly. They expect that they know how to breastfeed easily. So when the reality does not match, it can lead to frustration and sadness. So yes, hormones are one piece of the puzzle. A mother's mental health after childbirth is shaped by her situation, by her emotions, and also support system, and also the past experiences. And that's why it's important for everyone around her, like family, friends. In fact, the nurses who come visit their house, for example, after giving birth, they need to be understanding. They need to be like not judging them, and also being supportive. Right. So I think we can support the mothers better. We can provide or we can protect their mental health.
Thank you so much, Dr. Shaidai. While we're on this topic of biggest risk factors, right? So, as you mentioned, lack of support, some people might assume that the mother might just get over it eventually. But we know that postpartum depression doesn't just affect the mother, it can also affect other people. So, what are some of the ripple effects that you've seen on the baby, the partner, or the whole family itself?
Yes, you're absolutely right. Many people assume it's just a phase.
Mm,
She will get over it. But the truth is, postpartum depression um, does not just affect the mother, it affects the whole family. So let's talk about the baby first. When a mother is depressed, she may struggle to bond with her baby. She might find it hard to smile, hard to talk, or hard to respond to the baby's need. not because she does not love the baby, as I mentioned before, but because her mind is too overwhelmed. So over time, this can affect the baby's emotional and also brain development. And we know that lots of studies show that the babies born by the mother who had some level of emotional distress during pregnancy or during after giving birth, they may become more fussy, have trouble sleeping, or may grow up with some difficulties in behavior or learning. So now the husband or the partner, so many fathers or partners, they feel confused when their wife suddenly changes after birth from being a cheerful person to a more quiet, withdrawn, or easily get irritated. So they may not know how to respond, how to handle this. And of course, this can create tension in relationship. If the mother does not feel supported, or if there's frequent argument, it can affect the marriage and also the family space, and then the whole family unit. So when a mother struggling, the home environment can feel heavy or also stressful, right? And other children in the family may notice something is wrong. The grandparents or the in-laws might blame her for feel frustrated, for example. And this can lead to misunderstanding, silence, or even conflict in the family. So yes, postpartum depression has a ripple effect, like a wave that touch everyone around the mother. But here's the hopeful part. When we help the mother, we help the whole family. When a mother gets support, whether through therapy, talking to loved ones, or even simple acts of kindness, like she started to feel better again. And as she healed, her baby thrived, her relationship also improved, and the family also become stronger.
Thank you so much, Dr. Shaida, for that. Now,
Mhm.
this is the case scenario when mothers actually reach out for help. But let's talk about something that often hold mothers from getting the help they truly need, the barriers, the misconceptions surrounding postpartum depression. There's this widespread belief that a mother should feel nothing but joy after giving birth. Why is this myth so harmful, in your opinion?
Yeah, that's a very thoughtful question, and it touched on one of the biggest challenges we face in addressing postpartum depression, the myth that the mother should feel only joy after giving birth, right? So this myth actually harmful because it creates unrealistic expectations. When a mother struggles with sadness, anxiety, or exhaustion, she feels like she is failing, like something is wrong with her, right? So instead of reaching out for help, she hides her feelings. So this silence can make postpartum depression worse and delay the diagnosis and delay the treatment as well. So why does this myth exist? I believe that our social media, our society, often show the only the perfect picture of motherhood, smiling mothers, happy babies, adorable babies with the glowing faces. And culture beliefs sometimes say that the motherhood is pure happiness, and that complaining means being ungrateful, right? So you have to be grateful. Family may also pressure mothers to quickly bounce back or say that you have healthy babies, so, you have a healthy baby, so just be happy. And to shift this expectation, of course, we need to raise awareness, openly talk about the real emotions that come with motherhood, including the tough and the sad moments, right? So sharing real stories will help the mothers to feel less lonely. And we also need to educate the family members, the community, so that they understand postpartum depression is a medical condition, not a character flaw. We need also to encourage open conversation. We have to have a safe space where the mothers can express their feeling without fear. And the most important thing I would like to highlight, Sri Lanka, is we need to train our healthcare providers, the young nurses, young doctors. They need to ask about the mental health regularly, us mothers feel comfortable to share, and also use positive message like it's okay not to be okay. I think we have heard quite a lot of people say it's okay not to be okay, and asking for help is a sign of strength, right? So I think changing this myth won't happen overnight, but step by step with kindness and also understanding. Of course, we can create culture where the mothers feel supported and accepted exactly as they are.
I think we can come to a conclusion that it's just not on the mother's uh it's just not the mother's responsibility to look after her mental health, but it's also as a society, as a community, we need to help each mother feel supported in their childbirth journey and the
Yeah.
postpartum itself. So it seems like it's not only the family that plays a role, but it's also the healthcare providers, people around them, the society in general. So thank you so much, Dr. Rohaida, for sharing that. It's truly amazing that with the proper support that the mother can actually flourish well. In your clinical experience, how does the fear of judgment on its own or being seen as a bad mother affect a woman's willingness to speak up or seek help?
Yeah, I think the fear of being judged or being labeled as bad mother is one of the biggest reason why actually women hesitate to speak up or ask help for help. This is widely written in the literature too. Many mothers they worry if, let's say, they admit to feeling sad or feeling overwhelmed or feeling anxious, people will think that they are weak, ungrateful,
Mhm.
or not loving their baby enough. And of course, this concerns comes from strong cultural and societal expectations that the mothers must always be perfect, must always be happy. So when a woman struggles with postpartum depression, she may feel like she has failed in her role. And because of this, some mothers try to hide their feelings, even from their closest family members or from the nurses, from the doctors, from the other healthcare providers. So they put on a brave face and suffer in silence, um, which unfortunately makes her symptoms worse, right? So in Malaysia, many women also see postpartum depression as a personal problem
Mhm.
that they should handle alone. There's also common belief that it is not serious enough to need professional treatment, and sometimes they just don't know how they just don't know much about postpartum depression really is, and they don't realize their feelings are part of the medical conditions that can be treated. And on top of that, many mothers don't get support they need at home. Um, uh, their feelings are often minimized, dismissed by the people um, closest to them, like their husband, their family members. They might hear things like, "You are just tired, don't think so much. All mothers feel this way. You just have to endure. You just have to tahan," right? So these kind of responses, I remember one of my patients talk about when she tried to convey what she feels, try to um, express her feelings to husband. She's a Chinese mother telling the husband like, "You know what? I think I got depression now." And the husband said, depression? What is depression? Yeah, something like that. So when she received that kind of responses, no, she said, "That's it. I'm not going to talk more about my emotions with my husband," because that's the reply that she get from the husband. And of course, this kind of responses will make the mother feel even more alone and afraid to open up because of this reason, yeah, the stigma, the lack of knowledge, lack of support. Many women hide their struggles and suffer quietly. And this delay in seeking help can make their condition worse. And to change this, of course, we need to again educate the communities, right? Encourage the families, especially the husband, to validate their feelings, to listen and to support them. So we need a safe space for the women so that they feel comfortable talking about their feelings without fear of being judged.
When it actually comes to getting help, what are some real world challenges that mothers face in accessing maternal mental health care in Malaysia, especially in rural or low income communities?
So we talk about the challenges that the mothers have. Of course, we are talking about the limitations that we have in the rural areas, talking about the transportation, the financial constraints, right? And also the availability of the what we call professionals, what we call the professions over there. For example, the clinical psychologist, the counselor, um, the called the psychiatrists, the mental health nurses, how much we have in our country, and we know that this is the what we call the one of the biggest limitation why they didn't go and seek help. because there's number one, because of the what we call the people that are going to help them. Number two is because of their own limitations, the transportation, the baby management, for example. Someone need to take care of the baby, so that's why she cannot go and get help, for example. I think that's the biggest factor, other than what I mentioned before, regarding the stigma, regarding the perception of other people. If she go and seek help, for example, what we call will give some sort of perception that she's a not a good mother, for example. Yes, so you're talking about the rural issues just now, rural area just now. So I believe that the main factor were perhaps the transportation, the baby management, and also the availability of the professional help that present in that area.
What role can healthcare providers play in identifying and supporting mental health postpartum depression earlier compared to the later stage?
Sorry, Senaka, say it again. I didn't get the
Alright,
question
okay.
just now.
What role can healthcare providers play in identifying and supporting mothers with postpartum
Um,
depression earlier?
Yeah, I think that's a great question. Yes, of course, the healthcare providers, they play a very important role in identifying and also to support the mother with postpartum depression early. And this can really make a big difference in the mother's recovery. I think the role first healthcare providers are often the first people mothers see during and also after pregnancy, whether at the clinics, at the hospital, and also during home visit. And because of this trusted position, they have a chance to observe and also to ask about how mother is feeling, not just physically, but also emotionally. And second, healthcare providers, I believe that they should do routine screening for the mothers for signs of postpartum depression during antenatal and postnatal checkups, and simple question about their moods, their sleep, their appetite, their feelings of sadness or anxiety. I think this can help to detect the warning signs earlier. And in fact, they just can ask a simple question like, "Are you okay?" And believe me, Sri Lanka, this kind of question is very simple, but is very impactful for those who are in need of support or in need of someone to listen to them. Number two, number three, I think that healthcare providers need to improve their own scientific knowledge on postpartum depression so that they can provide education and information to mothers and families about postpartum depression, um, what it is, why it happens, and that is the postpartum depression is treatable, for example. And this knowledge will help to reduce the fear and the stigma in our community. Number four, that they can offer emotional support, listen with empathy, um, making mothers feel safe and understood and validated. And sometimes just having someone to talk can help a lot. And finally, I believe that healthcare providers can refer mothers to appropriate mental health services or counselors, for example, if they need it, and follow up to ensure that they get care they require. So, in short, I believe healthcare providers, the nurses, midwives, doctors, who especially working in the community healthcare setting, in the primary healthcare setting, they are the key people, they are the key person in early detection, the education, support, and also referral. So I believe that with proper training, with proper awareness campaign, they can help the mothers get the help they need quickly, which can improve the outcomes for both mothers and baby.
Smart of Shadi about what healthcare providers can do in providing support and for mothers who are struggling with postpartum depression. Now, speaking of healthcare providers, let's talk about the healthcare system in general, or maybe like treatment-wise, treatment and coping strategies. What are the most effective treatments available for postpartum depression, and how do therapy and medication work together in the healing process?
Yeah, I think that's an important question. The good news is that postpartum depression is treatable,
Mhm.
and there are effective options that can help mothers to recover. and feel better again. The most common treatments include therapy, the medication, or sometimes combination of both. And therapy means that the mother have the opportunity to talk with the trained mental health professionals, such as counselor or psychologists or clinical psychologists. And this helps the mother to understand their feelings, to learn coping skills, and to find ways to manage their stress and also anxiety. And types of therapy like cognitive behavioral therapy, it is very effective in changing negative thoughts patterns and also improve the mother's mood. The medication, usually antidepressant, for example, this can help to balance the brain chemicals that affect mood. And not all mothers actually need medication, but for some it is very helpful, especially if the symptoms are severe or not improving with therapy alone. Doctors will carefully choose medicines that are safe for breastfeeding mothers, also pregnant mothers, right? So when the therapy and the medications are used together, they often work better than either one alone. So therapy helps with understanding and the coping skills, while the medication helps to regulate the mood physically. So this combination will speed up the recovery, will improve the long-term well-being of the mother. So it is important for us to include also support from the family members, from friends in the healing process. So it is a combination with the ongoing therapy. So I believe that understanding environment will make a big difference. So yeah.
So, other than therapy, medication, and support from the family, what are some small lifestyle changes that these mothers can implement in their daily life? For example, maybe like sleep hygiene, nutrition. Can these contribute to emotional recovery after birth?
Yeah, I think small lifestyle changes can really help uh, supporting emotional recovery after the childbirth, especially when combined with other treatments. So sleep hygiene means that making sure that a mother gets as much good quality sleep as possible. So we know that lack of sleep can make feelings of sadness, anxiety, and also irritability become much worse. And maybe some of simple tips it can include like rest when the baby sleeps, right? Even if it is during the daytime, right? Avoid caffeine or heavy meals, or avoid heavy meals close to bedtime. Create a calm and also dark and quiet sleeping space. This is quite important for the mother to relax and reduce or limit the screen time before bed to help the mind relax. And of course, nutrition is also important. Eating balanced diet with enough vitamins and minerals, of course, this can help the body and brain work better. And some ways to support nutrition, perhaps to include plenty of fruits, the vegetables, as we know, right? The whole grains, the proteins, these are all important. Stay hydrated, drink plenty of water, right? Avoid too much sugar or processed food, which of course can affect the mother's mood. And sometimes some of the mother, they need vitamins, they need iron, uh, supplements, right? So they need, of course, before taking the supplements, they need to check with the doctors first. And besides sleep and nutrition, also gentle exercise like walking or stretching. This one also can boost the mood, right? By releasing the chemicals that we know are endorphins, right? So while these lifestyle changes alone may not cure postpartum depression, they will help to improve the energy for the mother, to reduce stress, and also to support overall well-being. So making the recovery easier and faster.
Thank you, Dr. Shadi, for sharing all of these small lifestyle changes that mothers at home, if they can't get the therapy that they need, maybe they can implement these small lifestyle changes. And also, when they have the time and the accessibility, they can reach out to healthcare professionals and seek medication or therapy. Thank you so much. In Malaysia's multicultural context, how do traditional or religious beliefs influence how women perceive and seek help for postpartum depression? We did touch a little bit about this earlier, but are there ways that these beliefs can be used in a positive manner?
That's a very thoughtful question. I believe that our country is a beautiful country with many cultures, many religions, and this belief can strongly influence how women see postpartum depression and whether they seek help, right? So some women might feel that they should be strong and not complain, as I mentioned before, because of the cultural expectations, because of the religious teaching. So this can make them less likely to speak openly about their feelings or ask for help. And sometimes mental health problems are misunderstood or thought to be caused by the spiritual issues, for example. And this can lead the woman to seek help from the traditional healers or from the religious leaders instead of the medical professionals. But this belief can also be used positively. Um, Many religion, many teachings in our religion, in our culture, promote the compassion, promote the community support, and caring for one another. And I believe that this value can encourage the family to show their kindness, to be patient, especially for the mothers who are struggling with postpartum depression. And these values also encourage the mother to take care of their mental health as part of the overall well-being. Based on my research, many women use religious practices as important coping strategies during their recovery. For example, in Muslim culture, practices like remembering God, the zikir, reciting the Quranic verses, prayers, this can help them to calm their mind and also provide comfort. And among the Christians, mothers, many Christian mothers reported that they recite Bibles, their prayers. They serve a source of strength and hope. And in Hindu cultures, women talk about the listening to the religious song. This can bring a peace and also reduce their anxiety. And that's some of the examples. And I believe that these spiritual activities, the religious practice, they can provide emotional support, right? Reduce their stress and also give the mothers a sense of connection and also meaning during a difficult time. So by combining traditional belief and also religious practices with the modern mental health care, of course, we can create a supportive environment where women feel respected, they feel empowered, and also encouraged to seek the help that they need.
Thank you so much, Dr. Shari, for sharing all those ways that traditional religious beliefs can contribute positively to postpartum depression. Now, can you recommend any postpartum mental health resources for our listeners who might be listening, available in Malaysia itself, maybe hotlines, NGOs, or support groups?
Yeah, absolutely. I think it's very important for mothers and family to know that help is available. So in Malaysia, there are several organizations and helpline that offer support for postpartum mental health. We have Befrienders. So Befrienders, I believe that many people heard about Befrienders. So it is a 24/7 helpline that provides emotional support for people feeling stressed or depressed. So they can call at any time if they need someone to listen. We have also Talian Kasih. This is government helpline for women and children facing any crisis, including mental health problems. So it's also available 24 hours. I have been working closely with the Relate Malaysia. This is one of the NGO that offers counseling services and also support for mental health, the family issues, and also emotional problems. So this NGO, they have experienced counselors to help. They also available at the website. So you just type Relate Malaysia. And the next one is support, SAPOT. So support provides counseling and support specifically for women facing emotional and also mental health challenges, including postpartum depression. We also have PKPM, Persatuan Kesejahteraan Psychospiritual Malaysia, also work closely with their team. So they work to raise awareness about the mental health and also offers the community-based support and also education. We also have MIASA, the Mental Illness Awareness and Support Association. So they offer spiritual support, they offer counseling, which can be helpful for many mothers. And also we have international also known as Postpartum Support International, and also Marcy Society, that's international. But I think the Malaysian one would be sufficient for the mother.
Thank you so much, Dr. Shadi, for sharing all these mental health resources for mothers who might be struggling with postpartum depression. I'm pretty sure that our listeners, as well as mothers who might be listening, will find these resources to be extremely helpful. Now, before we wrap up, Dr. Siti, we are reaching the end of our podcast. What words of encouragement would you like to share with mothers who might be silently struggling, who feel invincible, unheard, or overwhelmed?
Right, to all mothers out there who may be silently struggling, please know this, you are not alone, and what you are feeling does not make you a bad mother. Of course, being a new mother is the biggest changes in woman's life, uh, either physically, emotionally, and mentally. So it's okay to feel overwhelmed. Right? It's okay to not feel okay. Um, uh, just because people don't see your pain, it doesn't mean that it's not real. So your emotions are valid, your struggles matter, you matter. You don't have to go through this in silence. There is a help and there is a hope. There are people who care, whether it is your partner, your family, a friend, a counselor, or even someone on a hotline, right? So please reach out, uh, speak up, even in just a whisper, right? So because healing begins when we are hurt. So take one step at a time. Be kind to yourself. You are not weak for needing help. You are just human, and you are deeply loved, even it doesn't always feel that way.
Thank you so much, Dr. Shaidai, for sharing that. That is truly heartwarming, and I'm pretty sure to all the mothers out there who might be struggling, they feel heard and they feel truly cared for after hearing your words of encouragement. Thank you so much, Dr. Shaidai, for sharing all those lovely words. I'm pretty sure our mothers who might be listening to this podcast feel really heard and supported through your kind words of encouragement. Now, how about for our listeners? How can they become better allies to the new mothers in their lives? What are some simple but powerful ways to show support and empathy?
That's a very meaningful question, because the truth is, support from others can make all the differences for a new mother. So, to our listeners, if you have a friend, sister, wife, daughter, or colleague who just had a baby, your presence, your kindness, and your understanding can go a long way. So we need to listen without judging. This is very important. Listen without judging. Uh, I mean, sometimes the best thing you can do is just listen, right? So let her speak honestly, without rushing to give advice or saying things like, you should be grateful, or it's just a phase, or instead you can just say that I'm here, um, I'm listening, or I hear you, right? So number one, so listen without judging. And number two, offer practical help. New mothers are often tired, they're overwhelmed. So instead of saying like, let me know if you need help, or trying offering, so you can offer something like specific. Can I bring you food? Or do you want me to watch the baby while you nap? Or do you need a ride for your checkup, for example? So offer a specific, what we call, support for them. Number three, you can check them regularly, even a short message like, um, how are you really doing today? So this can make her feel like being seen or being cared for. So don't assume that because if she looks happy, she feels okay. So don't just assume. Ask them. And the next one would be respect her feelings. All right. So if she says that she's struggling, don't minimize it. Right. So avoid phrases like, everyone goes through this, right? Or just be strong. Okay. Everyone like to say that. Many people like to say that. But instead, we can say that it's okay to feel this way and you are not alone. So that's about the respect of the mother's feeling. And the next one would be encourage her to seek help. right? So if you are worried about her mental health, you can just gently suggest that it's okay to talk to the doctor or to talk to the counselor. So let her know that seeking help, as I mentioned before, seeking help is not a signs what you call that seeking help is signs of strength, not a failure, right? So recovery both physically and emotionally, of course, need time. So as a community surrounding the mother, we need to be patient. We need to be present, because new mothers, they don't need perfection from those around them. They just need genuine care. They need people to understand them, and they need love, right? So if we can do all that, even in a small way, I believe that we can help to build a safer world, safer environment, or safer space for the mother and also their families.
Thank you so much, Dr. Shadai, for sharing all the ways that people other than mothers can contribute to helping mothers who are suffering from postpartum depression to come out of it, to achieve a better, healthier life. And with that, that brings us to the end of today's episode of Breaking Barriers. A huge thank you to Dr. Siti Roshida and Mama Arifin for sharing such valuable insights and helping us understand the depth of postpartum mental health. Not only did I enjoy the session, I'm pretty sure our listeners would have also enjoyed today's session. It was truly fruitful and knowledgeable. Thank you so much. And to all the mothers out there, as Dr. Roshaidai have mentioned, if you're struggling, please know this, you're not alone. Your feelings are valid. Seeking help doesn't make you weak. It makes you brave. Very, very brave. Healing doesn't mean forgetting what you've been through. It means finding strength within it. We hope this episode left you feeling informed, supported, and seen. And as mentioned above, if you are suffering from postpartum mental health depression, please seek help using the resources that we have mentioned. You are not alone. Until next time, stay kind, stay aware, and keep breaking those barriers. Thank you.